So you or your child has been diagnosed with gastroenteritis. Some people call that the stomach flu. Basically, it just means an infection in your gut, like in your stomach and in your intestines. Sometimes it can be caused by a virus, other times by a bacteria or even a parasite, but usually it's a virus. Now remember, antibiotics do not work on viruses, so there's no point in taking an antibiotic. Really what you need to do is stay hydrated. Hydration, hydration, hydration is the key here. So if you or your child is actively vomiting, let them vomit and then don't try and replace those fluids immediately. Give their stomach a few hours before you try to give them any fluid or hydration. After a few hours, try very slowly. Don't go too quickly. So maybe a tablespoon of fluid. Wait 10 minutes and see what happens. If the person vomits, then stop. Give them, an hour to rest and then try again with a tablespoon. If they don't vomit, try another tablespoon after 10 minutes and continue on every 10 minutes, and you can slowly increase the amount of fluid that they take in. Now what do I mean by fluid? Water, Gastrolyte or Pedialyte if you have it, flat ginger ale, even Gatorade, although it's not great because it's got lots of sugar in it. But those are the kind of fluids that you need to be trying. If the patient can keep down the fluids for a few hours without vomiting and they're expressing hunger, then you can move to food. And you want to have really plain foods. You might have heard of the brat diet. I stole these from my daughter. Bananas, rice, applesauce and toast. You can also go with just plain chicken, which is a protein that's very simple, not the skin. Also clear soups and crackers are good things when your stomach's a bit upset. Don't try and go too crazy at first. So that's what you need. You can expect that the vomiting will last about 12 to 24 hours on average, and then that's followed by diarrhea, usually for a couple of days. If the diarrhea is really bad, you can take something to stop the diarrhea, like kaopectate or Lomatide that you get from the pharmacy. There's a little bit of lore out there. No one's really sure how it should be done, but in general we say wait for 24 hours or 1 day with the diarrhea before you take it. That way maybe you're getting rid of that virus, and after that you can take the medicine, the antidiarrheal, to slow it down and make things more comfortable. Don't expect after those few days are over that your bowels are going to go completely back to normal. Your bowels have taken quite a hit, and usually for a week or so afterwards your stools they're not straight diarrhea, but they're a little bit off. And so that's to be expected. Don't be surprised by that. If it continues for a while, then do see your family doctor about it afterward. Reasons to come back to the emergency room. Number one, again, hydration. If your child or you are not well hydrated. So in a child, you might look at their eyes and see when they're crying, are they actually producing tears? If they're not producing tears, they're very dry. Look at the number of wet diapers they're making if they're young, or how much they're peeing. You can also look at lethargy. Lethargy in medicine doesn't mean, when they're a little lethargic. Everyone's lethargic when they feel sick. I mean real lethargy. When you look at your child, you speak to your child, they don't turn and look at you, they don't make eye contact. These are the children who we put in the emergency room, we put in an IV, and they don't even flinch from the needle. So that's true lethargy. You need to come back to the emergency room for that. Lethargy, hydration. If there's blood in the diarrhea, you need to see your family doctor about that, or you can come to the emergency room if you can't see them, because that usually means it's a bacterial infection and you may need an antibiotic. And lastly, if the abdominal pain moves to one side or the other. Cramp is expected when you've got a viral infection in your gut, but if there's pain moving on one side or the other, then you need to come to the emergency room and be evaluated by one of us. I'm Dr. Atzema, and those are my discharge instructions for gastroenteritis.